Good afternoon to all of you on the East Coast, and good morning to you if you are on the West Coast. My name is Dr. Jose Leon. I am the Clinical Quality Manager at the National Center for Health and the Aging, a project of North American Management. I want to welcome and thank you for attending today's webinar, Meeting the Healthcare Needs of Lesbian, Gay, Bisexual, and Transgender Older Adults. This webinar is being recorded, and the resources, slides, and other materials will be emailed to you after the webinar has finished. At the end of the webinar, there will be a question and answer session, and we would like to ask all the attendees to please complete the post survey. This helps the National Center for Health and the Aging improve our webinars. The National Center for Health and the Aging main initiatives are we basically establish collaborations with national and state aging agencies. We conduct needs assessments with health centers programs and health center program lookalikes to determine primary medical care services delivery and needs among grantees that serve the elderly. We also provide national primary care, the National Primary Care Symposium on Aging, and we offer remote, on-site, and one-on-one training and technical assistance and peer mentoring. We also conduct the new HRSA BPHC grantee training and orientation call. We develop protocols and toolkits. We provide knowledge of health literacy and skills necessary to reading, understanding, and acting on basic healthcare information. We facilitate outreach to seniors. Just a brief introduction. And regarding the aging population, people 65 years and older represent around 12.4% of the population in the year 2000 and are expected to be 19% of the population by 2030. So the health and wellness of the elderly population is very important. It is also important that appropriate policies be created to address the specific needs of the elderly population, such as the public health aging policy. The estimated range of lesbian, gay, bisexual, or transgender Americans ages 60 and over is 1.75 and 4 million. We have data about some of the LGBT older adult health disparities, and the LGBT population, 20% experience distress compared to 9% of the heterosexual population, and the 22% of the LGBT population do not get prescription compared to the 13% of the heterosexual population. And the 29% of the LGBT population experience delayed care compared to 17% of the heterosexual population. I am going to introduce our presenter for today's webinar. Dr. Mark Simone Skidmore is a geriatrician and associate program director for the internal medicine program at Mount Auburn Hospital in Cambridge, Massachusetts. He is an instructor of medicine at Harvard Medical School and recipient of the Geriatric Academic Career Award. His academic and clinical areas of expertise focus on the care of older lesbian, gay, bisexual, and transgender adults, as well as the care of older adults with HIV. He was a member of the HIV and Aging Consensus Project, an expert panel convened by the American Geriatric Society and the American Academy of HIV Medicine to develop guidelines for the care of older adults with HIV. He sees patients for geriatric primary care and consultation at Mount Auburn Hospital. And Dr. Simone Skidmore is also a faculty member for the National LGBT Health Education Center, the Fenway Institute, which has a national cooperative agreement with the Bureau of Primary Health Care, HRSA, to provide training on LGBT health to health centers nationally. Now I would like to turn the presentation over to Dr. Simone Skidmore. Good afternoon, Dr. Simone.
Great. Thank you very much, Dr. Leon. And thank you to the National Center for Health and the Aging for asking me to present this important topic. So on behalf of the Fenway Institute National LGBT Health Education Center, what we'll be talking about for the next hour is very important. As Dr. Leon introduced, we'll be discussing the healthcare needs of the LGBT older adult population. So at the end of this presentation, you should be able to demonstrate awareness of the specific health disparities that affect LGBT older adults. And I'll go into details with specific examples of the healthcare disparities that do affect this population. Also, at the end of this presentation, you should be able to understand the impact of a lifetime of discrimination for LGBT older adults, and we'll explore that in greater detail, both in terms of the discrimination faced within the healthcare system and society in general throughout the lives of this older population and how that now impacts their health. And lastly, at the end of the presentation, you should be able to understand some of the key legal and financial issues that also affect LGBT older health, while also being more aware of the services in the community that are available for this underserved population. So just as by way of introduction, the issues of LGBT health in general have gone through changes over time. Initially, with the beginning of the gay civil rights movement, there was a movement for society to be aware and accept LGBT individuals. And then, of course, there was the impact of the AIDS epidemic that greatly impacted especially gay men. The ongoing civil rights movement for gay rights. And now what we're also realizing are that older adults who are LGBT also have specific needs. So first, let's think about this in the example of a case. So let's say you're a healthcare provider, or just thinking about an older patient who, in this example, is an 82-year-old man who comes to his primary care office for an initial visit. And he's there to establish care. So during that encounter, should the provider ask about his sexual orientation? Why or why not? And then, is it important to ask? So hopefully at the end of this talk, I'll be able to make the case as to why it is important, and that the provider should therefore ask about sexual orientation. So first, let me discuss some of the demographics of the older LGBT population. Dr. Leon had a slide that was that also had some important information. In terms of the numbers, similar to what Dr. Leon had presented, it's estimated that there are probably about 1 to 3 million older LGBT adults at this time. There was a survey, and the results are on your screen, from 2012, which was a large national survey by Gallup, which found that in general, 3.4% of the general U.S. population identified as being LGBT. And for those who are over 65, what you can see circled in red, less than that 3.4% average reported being LGBT. About 2% in the geriatric population, or those over 65. But what also is notable is that 6.5% did not answer the question. And I believe that a significant portion of those who felt uncomfortable perhaps answering that question were also LGBT. And this just illustrates how difficult it is, especially for older generations, to be able to disclose, especially written down, what their sexual orientation is. And I'll go over later on why that may be. But otherwise, we have very little data on exact numbers, but at least this is one report that gives us some information on the older LGBT population. So as I mentioned, it's estimated between 1 to 3 million older adults are LGBT, and as our population ages in the U.S., the number of older adults who are LGBT will also grow, so that it's estimated between 2 to 6 million older adults will be LGBT by the year 2030. As far as we know, the socioeconomic information comparison of LGBT older adults to heterosexual older adults are roughly similar, with a couple notable exceptions. While generally economically they tend to be similar, lesbian and bisexual women, as well as same-sex female couples in various surveys, are shown to have higher rates of poverty than when compared to both gay and bisexual men as well as heterosexual. And some of that is thought to be due to just income disparities for women in general, which would disproportionately impact lesbian and bisexual women or female same-sex couples. According to U.S. Census data, LGBT people live in every state in over 90% of U.S. counties, but in general, the LGBT population tends to live more in urban areas. So moving on, I'd like to first provide some background on the disparities that have impacted this population. And a lot of that has to do with discrimination that this older population has faced throughout their lives. So again, when you think about that 82-year-old patient who was meeting his primary care provider, and not only we raise the question about whether or not the provider should ask about sexual orientation, I also would like to raise the rhetorical question of what barriers might keep the provider from asking that question, and then also why might an LGBT person not be able to disclose their sexual orientation? What are the barriers that would keep them from disclosing? There has been a lot of press recently, both in the lay press as well as in the medical literature, raising these issues of disclosure and healthcare disparities in older adults. And the Healthy People 2020 also identifies specifically LGBT Americans as one of 6 groups that are affected by healthcare disparities. And then just recently in 2011, the Institute of Medicine also released a landmark report about the health of LGBT people, where they really, in that report, again, comment on the known healthcare disparities that affect the general LGBT population, and also comment on the really need for more information and more research into this area. So I'll give you some specific examples about what these disparities are. So from one survey in 2011, as you can see, LGBT older adults report pretty significant rates of disability, depression. 66% reported that they had been victimized 3 or more times. 13% said that they had been denied health care or received inferior care. And then another 20% said that they did not disclose their sexual orientation or gender identity to their own physician. And then a third had no will or power of attorney for making healthcare decisions. In another survey, this is a survey of people over 50 years old, specifically in Washington State, just published in 2013, which also looks at other outcomes of healthcare disparities. So looking at both smoking and drinking, lesbian, bisexual women, as well as gay and bisexual men tend to have higher rates of smoking and also excessive drinking, even in those who are over 50. Mammogram screening is less likely to occur in older lesbians. Both gay and lesbian older adults report, again, higher rates of disability, similar to the previous survey. Gay and bisexual men also report greater rates of poor physical health, and both lesbian and gay and bisexuals who are over 50 report poor mental health. Obesity is more likely to occur in lesbians, as well as cardiovascular disease. So these are just some recent examples documenting the healthcare disparities that exist. And I'll make a case that some of this has to do with the discrimination that LGBT older adults have faced throughout their lives, as I mentioned, both by the healthcare system but also society in general, which has led to trouble or difficulty with disclosing sexual orientation and all of the impacts on health that that may have as well. So this is an illustration of the impact throughout the lifetime of a hypothetical 70-year-old lesbian woman who, in this example, she was born in 1940. So at this point, she would be 73. And you can see all of the events that have happened in our history in the U.S. that would have impacted her life. So for instance, being gay was actually considered a crime, even if there was consensual homosexual acts. And it wasn't until 1962, at the time that this hypothetical person would have been in her 20s, so it wasn't until 1962 that the very first state decriminalized consensual homosexual acts. And then it wasn't until 2003 that the U.S. Supreme Court struck down sodomy laws in the remaining states that still had those laws. So technically it was a criminal act in some states up until 2003. Being gay was also considered a mental illness up until 1973, when at this time our hypothetical patient would have been in her 30s. So in 1973, the American Psychological Association no longer classified being gay as a mental disorder. But up until that point, it was practice to institutionalize people against their will to try to, in quotes, cure them of being gay. And this continues to, for especially our older population, have a role in why they may be less likely to seek psychiatric care after having witnessed personally or with friends the experiences in dealing with psychiatry earlier in their lives. I also just want to point out that it wasn't until 1982 that the first state outlawed discrimination based on sexual orientation. And then again, it wasn't until 2004 that the very first state recognized same-sex marriage. So for our older adults, much of their lives have been spent without the ability to get married. So all of these events throughout our recent history have greatly impacted our older population, and in ways that the younger LGBT population haven't experienced. I do also want to point out that for transgender adults, the discrimination that they have faced and still face now is even greater. There's even more social stigma. There's much less general acceptance, tolerance, and awareness of transgender needs. There are even greater mental health needs, and I'll discuss this a little bit later. But all of this can lead to psychological pain, substance use disorders that are greater in the transgender population, and this also impacts their economic viability as well if they're at greater risk of losing their jobs or just facing discrimination in employment as a result of being transgender. I do also want to point out that much of my talk, when I'm talking about older LGBT adults, while in general it applies to people over 65, there are also generational differences or differences in cohorts. So the older generation which I'll sometimes refer to as the pre-Stonewall generation. This pre-Stonewall generation are those who are now in their 70s and 80s. They're before the baby boomer generation. And unlike the baby boomer generation, they never had any of the outreach efforts, the presence of any gay civil rights movement. The experiences that they felt in terms of just general discrimination being more widely accepted were even greater than the baby boomer generation. And Stonewall, just as an FYI, refers to the Stonewall riots in 1969 that really became a focal point for the beginning of what's called the gay civil rights movement. And those riots were in reaction to police harassment of gay nightclubs. And so that reaction to that harassment is really what began the visibility and the seeking of equal rights. So again, our older population, those now in their 70s and 80s, that pre-Stonewall generation, their experiences are very different even than the baby boomer generation, and certainly different than the current younger population. So those healthcare disparities and the discrimination that they faced have really played a role in the disclosure of sexual orientation in older adults. And as I mentioned earlier, we don't really know how many older adults are gay, and again, that's partly related to just the difficulty in older adults in being able to self-identify. We do have this survey of the baby boomer generation, and in this survey, about 3/4 of lesbians and gay men report that they are either completely or mostly out of the closet, with more like 57 to 61% reporting that their families are either completely or very accepting. The numbers are much smaller for bisexuals and transgender, both in terms of disclosure and acceptance by family. So for the older population, that pre-Stonewall generation, who is much less likely to disclose their sexual orientation, many of them have lived wholly or partially in the closet, hiding their sexual orientation, sometimes even hiding their relationships. So they may refer to their lifelong partner as a friend or a roommate. And sometimes it's the elephant in the room. The family knows, but no one discusses it. Or sometimes the LGBT individual will go through great lengths to hide that relationship altogether from their family. And so as a result, sometimes, and especially more so in the older population, they have to create these elaborate constructs to protect their sexual orientation. But as they get older and as they become frail, perhaps needing help with people coming into their homes, such as visiting nurses or social workers, they become, that elaborate construct becomes at risk of exposure. And that can create a barrier for the older population who's trying to hide their sexual orientation, hide these relationships from people being able to know about it. That can create a barrier from them accepting the help that they need at home. And for those who are out of the closet, the older generation is also more likely to be estranged from their children. Many in the older population may have had failed heterosexual marriages and may have children from those relationships, that as they're now out of the closet and perhaps in same-sex relationships, their children or grandchildren may not be accepting. But they're also, as in general, the older population who's gay also is more likely to be single and without children. And as a result, they often will rely on what's called chosen families, which are really extensive support networks of their peers who help to provide care for them and care and support. However, as these networks age, that network can then become fragile and threatened by aging and illness. So these older adults who are LGBT may have greater needs for support, especially if they don't have it from their own family. I also want to talk about the impacts of discrimination on health in general. So those who are LGBT face social stressors throughout their lives. I've talked about disclosure, but in general, the coming out process, the process of disclosing one's sexual orientation, it's not just a one-time event, but it's a lifelong process. Every time an LGBT person meets someone, they have to decide, can I, should I, is this the right time to disclose? And so that leads to stress, depending on one's comfort in who they are. As I mentioned, there's been significant prejudice and discrimination faced, especially in the older generation. That includes stigmatization, anti-gay violence, and then there's internalized homophobia for those who are LGBT but don't want to accept it and haven't been able to cope with it, and so they internalize that homophobia. And all of these social stressors faced over time can certainly be risk factors for depression, suicide, risky behavior, and substance abuse. So next I'm going to talk about the mental health of older LGBT adults. Again, the research is lacking in terms of the rates and prevalence of some of these mental health disorders. But in general, we believe that there is an elevated lifetime prevalence of major depression and generalized anxiety disorder in LGBT individuals. And also in older LGBT individuals, there tends to be greater current levels of depression and generalized anxiety disorder as well. Now, suicide, we do know, is especially important and identified as a major problem in the LGBT youth. It's less known how suicidality still impacts older adults. But there was this survey of about 400 older LGBT adults who reported that in their lifetime, 39% had considered suicide at one point, and 12% had considered suicide in the past year. And I do also want to make the point, as I mentioned earlier, that the mental health problems of transgender adults are even less understood, but they do experience tremendous major life changes and discrimination, and so they, even more so than LGBT individuals, transgender adults, including older adults, are more likely to have adjustment disorders, anxiety disorders, PTSD, substance abuse, and depression. So along with aging for everyone, gay or straight, there are certain fears of aging. However, those who are LGBT have some additional fears, and those include rejection by children and family. As I mentioned earlier, some older LGBT adults have children who may not be accepting that their parent has come out of the closet or has a same-sex relationship. And if an older LGBT adult has not yet disclosed that information to their family, they fear that if they find out, they will be rejected and no longer have their support. And so some of the other fears include uncertain support networks, and then discrimination within the healthcare system, as well as employment, housing, and long-term care. Previously, I mentioned a survey of LGBT baby boomers, and this data also comes from that same survey. So when they asked the LGBT baby boomers what their greatest concern of aging was, significant numbers reported that their greatest concern was discrimination in the healthcare system based on their sexual orientation. And over 50% reported that they lacked strong confidence that they would be treated with dignity and respect by the healthcare system. And notably, 12% of lesbians commented that they had absolutely no confidence that they would be treated with dignity and respect. And the survey is from 2006 of about 1,000 LGBT baby boomers. So this fear of discrimination certainly can lead to avoiding care, which also is a significant problem in nursing homes and assisted living facilities for older adults who are fearing discrimination in those unique situations. And of course, by avoiding care and fearing discrimination, that leads to non-disclosure of sexual orientation. And non-disclosure, therefore, can lead to inappropriate preventive care and inappropriate or less screening. And of course, non-disclosure has other impacts. So it can impact the patient-provider relationship. If the patient never feels comfortable enough to disclose a significant aspect of one's life, then that can impact the relationship with their provider. And in general, non-disclosure perpetuates the invisibility of LGBT older adults. So I'm making the case for why it is important for healthcare providers to ask about sexual orientation. And the goal of asking is to be able to provide sensitive care, to address the unique healthcare needs that this group has, to identify any potential challenges to the support systems for this group, as well as being able to provide opportunities for disclosure and a better patient-doctor relationship. So how do you ask these questions? I'll give you some tips. One, don't assume that all older adults are straight. And also don't assume that just because an older adult does mention that they are in a same-sex relationship or that they are living with their lifelong partner, that may still mean that they're not comfortable with full disclosure. So the language that we use matters, especially when meeting a patient and obtaining a spousal and sexual history. So a question that seems fairly benign, which is, are you married? For older adults, that question for older adults who are LGBT actually may in and of itself raise some barriers, because many older adults have never had the opportunity to get married, or at least have their relationship recognized as a marriage in their state. So when you ask that question, for some older adults, it may right away create a barrier or make the patient no longer feel like they can open up entirely. So some better ways to ask that very simple question are examples here. So you could ask, who's important in your life? Do you have a significant other or a spouse or a partner? The question that I like most is, are you in a relationship? Do you live with anyone? Or a very open-ended question, tell me more about yourself, and see where that goes. So these are different ways of asking that same question about marital status that allows LGBT older adults to also more openly describe who's important to them. And then from there, a provider could also inquire into their sexual history, and that's beyond the scope of this talk. So I've hopefully made the case for why inquiring into sexual orientation is important. A lot of it has to do with the healthcare disparities that this group faces, and specifically as a result of discrimination, the mental health care needs and the barriers to care that the older LGBT population face. Next, I'll describe some of the specific medical needs of this population. So I mentioned earlier differences in rates of smoking and alcohol use. This is another very large survey from California of heterosexual and LGBT individuals. And from that survey, lesbians and gay men, when they were younger, were more likely than heterosexuals to report smoking, as well as higher rates of alcohol use. And as they aged, when they were older than 50, lesbians were still more likely to be smoking than heterosexual women. while at least in this survey from California, gay men reported equal rates of smoking as well as equal rates of alcohol use. And this survey is somewhat contradictory to the previous data where both smoking and alcohol in lesbian and gay men were higher for older adults. So specifically thinking about older gay men, there are several issues of note. For older gay men who engage in high-risk sexual behavior, they are at risk of sexually transmitted infections. Because of the greater prevalence of smoking, they are at greater risk of cardiovascular disease, and smoking is a significant risk factor for cardiovascular disease. Also, anal cancer, interestingly, is much more prevalent in men who have sex with men. The prevalence rates there are on the screen, and a lot of this has to do with the human papillomavirus, or HPV, which is the same virus that causes cervical cancer in women. The virus can cause changes in women in the cervix that lead to cervical cancer, and in men, HPV, being a sexually transmitted infection, can lead to changes in the anal mucosa, which can lead to anal cancer. And so men who have unprotected anal intercourse are more likely to have anal cancer, and especially if they have HIV, the rates approach 90%. And so it's recommended that that men who have sex with men, especially if they've had unprotected receptive anal intercourse, should have anal pap smear screening. Then lastly, I'll mention prostate cancer. For gay men, there's no difference in terms of prevalence of prostate cancer, but the prostate being a sexual organ for gay men, the treatment of prostate cancer can have impacts on the sexual health of older gay men. And so that's an important consideration that should be discussed with older gay men when discussing treatment options for their prostate cancer. I mentioned earlier that lesbians are less likely to receive preventive care, and there was an Institute of Medicine report a decade ago that outlined this important healthcare disparity for lesbians. And so lesbians in general tend to access healthcare services less often. They enter the healthcare system later, and as a result can receive inappropriate care. And it seems that disclosure of sexual orientation affects screening practices. And a lot of this has to do, again, with differences in rates of disclosure of sexual orientation and fear of discrimination by lesbians. So for older lesbians, there are greater risk factors for coronary artery disease. Coronary artery disease in general, for all women, is the #1 killer of all women. But for older lesbians, they have higher rates of obesity and, as I mentioned earlier, smoking, both of which contribute greatly to the development of coronary artery disease. Cervical cancer in lesbians also is a risk to consider. Again, a lot of this has to do with screening. So lesbian women tend to have inappropriately less pap screening. And those who do have appropriate screening are more likely to have disclosed their sexual orientation. So disclosure rates are linked to the rates of pap smear screening. Breast cancer also, there's no evidence that there are higher rates of breast cancer in lesbians, but there are greater risk factors that tend to be more common in lesbians. Again, obesity, smoking, and also less likely to have children, all of which are known risk factors for breast cancer. I do want to mention the medical concerns for transgender older adults. And again, it's with a disclaimer that there's very little research available in this area. But we do know that transgender adults are more likely to face discrimination and disparities, and therefore are more likely to use black market hormones in order to achieve their transition if they don't have access to health care in order to obtain treatment for their transition. They are less likely to receive preventive care. They have greater mental health care needs that are less likely to be met, and they also have greater rates of substance abuse, and therefore linked with that greater rates of hepatitis C and HIV. It's also notable for older transgender adults that the preventive care should also be focused on their biologic sex. So, for instance, a man who has transitioned to a woman, even if she has had surgery, she may still have her prostate, which means that, again, a man who's transitioned to a woman could still have prostate cancer, and similarly, a woman who's transitioned to a man could still have ovarian cancer. And so it's important for older transgender adults to be able to disclose their gender identity and the fact that they are transgender, so that appropriate preventive screening and awareness can be had by their providers. Also impacting transgender health, these are some results from a survey of transgender adults who reported 70% saying that they had delayed their gender transition out of fears of facing employment discrimination. 13% in the survey reported abusing alcohol or drugs as a way to cope with mistreatment, and alarmingly 16% had attempted suicide at least once. So definitely transgender adults, including older adults, tend to have certain healthcare needs that need to be addressed. I very briefly want to mention the impact of HIV and AIDS in older adults. We do know that people are living longer with HIV, and so the population with HIV is aging, but there are also increasing rates of new infection in older adults, and a lot of this has to do with unawareness of proper sexual practices for preventing transmission of HIV and other STDs, especially in older adults, and also the barriers to general sexual health education, including HIV prevention. Healthcare professionals often feel uncomfortable discussing sexual function and sexual health in general with older adults. Some older adults may be less likely to want to discuss their sexual activity, and also they may be less aware, as I mentioned earlier, of the need for using preventive measures. I also want to mention that for older LGBT adults, there may be differences in their palliative care needs. So there was one review article that expressed the need for greater training of palliative care professionals, and that sexual orientation was important to address at the end of life, because older adults who are LGBT may be struggling with issues, or they may have fears of their partners being excluded from making decisions. And so even at the end of life, it's important to consider this while approaching their care. And there also tends to be perhaps some differences in their palliative care wishes in general. One survey found that lesbians versus heterosexual women tend to have more positive views of hospice, prefer alternative therapies, and also we're less likely to desire life-sustaining treatment. In the interest of time, I'll briefly cover some of the services and resources that are available for LGBT elders. This quote from a 66-year-old lesbian I think says it all. She says, "Isolation, finding friend support, caregiving, and health are the biggest issues that older gay persons face. Who will be there for us? Who will care for us without judgment?" I mentioned earlier that nursing homes and assisted living facilities present a unique and scary time for older adults, and especially for those who are LGBT. They may find that even if they were out of the closet earlier in their lives, when they are now vulnerable and relying on others for care, they may feel uncomfortable in disclosing their sexual orientation. They may hide pictures of their loved ones. They may worry about the reaction of other residents in their facility, as well as reactions by the staff who are helping to take care of them. And in general, we just don't know yet what specifically are their needs, but there are some anecdotal stories and news articles about highlighting instances of discrimination faced by LGBT older adults in nursing homes. In a survey of older LGBT adults, not surprisingly, they report fearing being rejected or neglected in long-term care. They fear having to go back into the closet. For some, would prefer to have a residential option that is specific for gay older adults, whereas others would prefer to be in a facility that treats all people, but where they're welcome as well. But they do fear being maltreated, ostracized. They worry about who's going to be able to help take care of them, bathe them, wash them. Are they going to be more rough with them if they know that they are LGBT? And so some of these fears lead to feeling alone as well. So what services are available? And lastly, I'll end with what are some of the legal issues that are also affecting this population. So older LGBT adults, for reasons that I mentioned earlier, are more likely to be isolated. They are half as likely as heterosexual older adults to have a significant other, 4 times more likely to have no children to help them, and about half, over 50, live alone compared to 33% of heterosexuals over 50. So more likely to live alone and less likely to have children to support them. And yet they also are unable sometimes to identify who's going to be able to help them when they need it. They often feel lack of support and unwelcome in mainstream aging programs, as well as in programs available within the broader LGBT community. In this survey, LGBT elders and transgender elders were more likely than heterosexuals to delay or seeking care as a result of fearing discrimination, and 10% reported being neglected by a caretaker because of their sexual orientation. I'm going to skip over the next couple of slides, which basically highlighted the need for greater education among community-based aging services, specifically regarding the needs of LGBT older adults. And I do want to highlight that there are resources available. So for instance, the SAGE Center, which is based in New York, has innovative programs that address the health and wellness of LGBT older adults in New York City, but also have resources that are available across the country. And also the National Resource Center on Aging, which on LGBT aging, which is a project of SAGE, and in partnership with several other organizations, have a clearinghouse of information, and that website is on the slide, where resources available for older adults can be accessed. And lastly, I just want to mention very briefly that there are financial and legal challenges facing LGBT older adults. There have been cases of same-sex couples being denied the ability to make decisions at the end of life, or in acute situations being denied access to visit their loved one as when they were in the hospital. And so in many states where same-sex couples are not able to be legally married, they're seen as legal strangers. And so LGBT individuals, not just older adults, but all LGBT individuals, need to be very aware of this and pay even more attention to having their wishes explicitly written down, signing healthcare proxies or power of attorneys, meeting with a lawyer to discuss their estate wishes, all of which takes time and resources, which may not be available. But unless these advance directives are in place, the default may be actually harmful for patients if the state recognizes an spouse or a child instead of their actual lifelong spouse as the decision maker, that can have significant impact. And just in terms of financial concerns, a lot of this is changing. Recently, in the summer, the Supreme Court ruled against a provision of the Defense of Marriage Act, and so now the federal government has extended the benefits that are available to same-sex married couples. But still there are differences in some of the pensions and other survivor benefits depending state by state. And a lot of those differences can impact the financial security of older adults as well. And this slide just shows that, as I mentioned earlier, that senior lesbian couples have about twice the rate of poverty compared to heterosexual and even gay couples. So I know that's a lot of information, and I apologize for rushing toward the end, but I do want to make sure I leave some time for questions. I'll summarize by stating several key points. It's assumed that there are roughly 3 to 8% of the elderly population who is LGBT. LGBT older adults have specific medical, psychological, and social needs. They may have difficulty in disclosing their sexual orientation due to past negative experiences and having faced a lifetime of discrimination. So healthcare providers must be able to provide the appropriate support and resources that address their needs and that are sensitive to their needs. And then lastly, LGBT older adults are at risk of isolation and lacking support. They have reduced access to aging programs that are specific to LGBT older adults. They fear and face discrimination in long-term care settings. Advanced directives are critical for this older population, and legal and government policies may contribute to financial insecurity and barriers to accessing care. So with that, I will stop and open it up for questions.
Thank you, Dr. Simone Skidmore, for this outstanding presentation. We're going to begin the Q&A session. If you have any questions, please submit it through the question box on your control panel, or use the hand raise icon and your line will be unmuted.
So I do see that there is a question that was posted earlier. I can answer that question.
Sure.
It says, are LGBT elders open to discussing their sexual health needs with providers? As I mentioned earlier, I think it depends. You never want to make a general statement about one population, but I would say in general, the older population, the issue needs to be addressed very sensitively. And my approach is to just ask very broad, non-judgmental, open questions so that I give them the opportunity to tell me. Like I said, my approach is to ask them about who's important in their life, who do they live with, and get a sense that way. And then if they do tell me if they live with a partner or they live with a roommate or a friend, I try to delve a little bit deeper. And if I get pushback, if I feel like they're uncomfortable, I'll explicitly say, do you feel comfortable with me asking that question? So yes, I do think that they are open to discussing it, but a lot of it depends on how we ask the questions, and also some of our nonverbal cues too. So everything from the forms that we use in the office to other displays that might show that we're LGBT friendly, that will make a difference too. I hope that answers the question.
Yes, thank you, Dr. Simone. There is another question in the queue. How can you train staff to properly care for LGBT elders?
Right. So there are specifically training programs. I know in the Massachusetts area where I live and work, there is a project of the LGBT Aging Project, which I believe is now linked with the Fenway Institute. And they, as an example, have a workshop that is available to hospitals, nursing homes, community service organizations that helps exactly train the staff and through education, going through some of the topics that I discussed. I think a lot of it in terms of education is just raising awareness. I think just because the older LGBT population tends to be invisible and much less likely to vocally say who they are, they tend to fly under the radar. So I think the biggest step is being aware and then also being sensitive to their unique needs. So there are formal workshops that could be available through, for instance, the LGBT Aging Project or through the resources of the SAGE program. I think that would be a good place to start. I know also the Gay Lesbian Medical Association has information and guidelines on suggested ways of asking questions on forms and surveys that non-judgmentally ask about sexual orientation and sexual identity or gender identity. And then I believe the National LGBT Health Resource through the Fenway Institute also has examples as well on their website.
Thank you, Dr. Simon. And I think that this question is somehow related to the previous one. Are you aware of any special training or certification for work with LGBT aging populations?
I am not aware of any specific certification, but the training I mentioned earlier would be available through those resources I mentioned. But no, I'm not aware of any added, certification that can be available. I know that the Human Rights Campaign has accredited healthcare institutions, specifically hospitals, on their with an LGBT equality measure. And so that is a way for a hospital organization to be able to promote how inclusive they are and by reporting their score on this index through the Human Rights Campaign. I don't believe they have expanded that for instance, nursing homes, but that might be a good idea.
Great. Thank you for that answer. Great answer. There is another question in the queue. What additional funding is available to health centers besides Ryan White for treating aging population with HIV? Do you have additional information?
Oh, specifically to older adults with HIV? Was that the question?
Right.
My first, I don't know specifically, but my first thought would be HRSA would be a good organization to see what grants are available, because I believe they often are supporting programs that promote and address healthcare disparities. So as a federally funded organization, I believe HRSA would be a good source. I'm not aware specifically of other options. I don't know if anyone else on the call is, but.
Okay, thank you, Dr. Simon. There is one more question popping up right now. Do you have any recommendation on how to reach special LGBT populations, such as homeless or public housing residents?
How to reach them in terms of being able to provide care to them?
To provide care, yes.
Yeah. Okay. That's a very good question. Certainly, homelessness in general for the older population is definitely a unique concern. And as I mentioned, older LGBT adults have more fragile are at risk of more fragile networks and less support, so they could be even more at risk of being homeless and impoverished. I do not know specifically of a way, an outreach program or a specific way to reach them, unfortunately. But that's I think that's a very important question that's raised. I wonder if, for instance, through the SAGE organization that I mentioned, being in New York City, if they have an outreach program specifically for homeless older LGBT adults. That would be my first place to look.
Okay, great. And we have, this is the last question for you, Dr. Simon. Do you know, or do you have any information about groups or community partners that are most likely to offer outreach and enabling services to LGBT elders?
Yeah. So I don't know if you can see my presentation, but there are resources available. I have a slide up. Okay, so I think you should be able to see this now. So these are examples, some of which I've mentioned, of resources and national organizations which I would suggest turning to. So I've mentioned SAGE, which is the Services and Advocacy for LGBT Adults based out of New York. I mentioned the Gay Lesbian Medical Association. There's the American Society on Aging, which has information specific to LGBT older adults. Fenway Community Health Center, I mentioned the LGBT Aging Project. So these are all national resources that provide education and outreach that hopefully would be a good place to start with seeking resources.
Great. Thank you very much, Dr. Simon. And one more time, I want to thank you for your outstanding presentation. We need experts like you to keep us abreast on LGBT issues. To all of our attendees, please complete the post survey. This helps the National Center for Health and the Aging to improve our webinars. And if you have any training or technical assistance need, please contact any of our talented staff members. Once again, thank you very much for attending this webinar, and thank you, Dr. Simon, for your presentation.
Great. Thank you very much.